Hi. So our video today is about tretinoin. What is tretinoin? Benefit of tretinoin when you use it on your skin. And lastly, how do you use tretinoin so that it will do the job that it's supposed to do? How not to abuse it. Yes, how not to abuse it when you use it on your skin. Okay? Now, if you are visiting my channel for the first time, welcome. It's good to have you here. My name is CHIKA. I'm a certified esthetician, and my channel is all about skincare. I do product recommendations. I do a lot of skincare product reviews, and I also do a bit of DIY once in a while. So if you like what you're watching, don't forget to click the subscribe button and become part of this family, and also the bell button when you're subscribing, just to keep you up to date on what is happening on my channel. Okay? And for my regular visitors, I love you. Thank you so much for coming back. So tretinoin is a powerful retinoid medicine. Some of the things that tretinoin can do when you use it on your skin is it helps to fade dark spots. Okay, so by fading dark spots, it gives you even skin tone. Okay, and another thing that tretinoin does to your skin is it helps to reduce the damage caused by overexposure of UV. So UV exposure, and when you have a lot of UV exposure, your skin can develop sunspots. So tretinoin helps to treat sunspot, which is caused by overexposure to sunlight, overexposure to ultraviolet, the UV. So when you have that, you can use tretinoin to treat it. Another benefit of using tretinoin in your skin is tretinoin helps in treating hyperpigmentation, and it does this by decreasing the production of melanin. Okay, because some of the hyperpigmentation that we have is as a result of too much production of melanin on a particular area in your skin. So what tretinoin does is it helps to reduce the production of that overproduction of melanin, and by doing so, it helps to lighten your hyperpigmentation. So it can be used as a skin lightener, but not as a bleaching. It's not a bleaching agent, but it can be used as a skin lightener to lighten your dark spots or lighten your hyperpigmentation, and is a safer option than hydroquinone. Okay, now tretinoin also have anti-aging benefits. So it can prevent, treat, and reduce signs of aging, premature aging. Okay, so regular use of tretinoin will help to reduce signs of aging, fine lines, wrinkles, and like I mentioned earlier, sunspot, because sunspot also is a sign of premature. When your skin develops sunspot, is as a result of overexposure to sun, and also part of premature aging signs as well. All right. So one other thing I love about tretinoin is it helps to prevent dead skin cells from clogging pores. Okay, because some of the breakouts that we have, some of the acne that we have, is as a result of clogged pores. Those clogged pores form a bacterial infection, and then from there your skin will develop acne. So Tretinoin will help to do that, to prevent dead skin cells from clogging your pores. So basically it can stop your skin from breaking out. Okay, it stops your skin from breaking out, it stops your acne from forming, and in doing that gives you an even skin tone. Now the next question is, how do you use Tretinoin? Because it has a lot of side effects if you abuse it. So Tretinoin is usually by prescription. Okay, it can be prescribed by a dermatologist, a skincare specialist, and also a healthcare worker, more like a physician, to treat your blackheads or treat your hyperpigmentation or treat your dark spots or treat your acne. Okay, it has to be used by prescription, because when the specialist that's going to prescribe it for you will tell you the amount of time you have to use it, when you have to use it, and how to use it based on your skin type. Tretinoin is not something that you could just go by and start using without knowing what you're using, because if you do that, there is a lot of side effects when it comes to abusive use of Tretinoin, the likes of skin irritation. It can make your skin to become overly sensitive. It can make your skin to become very red. It can make your skin to become very dry if you use too much of it, if you overuse it, if you abuse it. Yeah, it can make your skin to become very dry, very, very dry. Okay, if you don't use it as prescribed by your physician, dermatologist, and skincare specialist. So basically, use a prescribed Tretinoin, because if you use prescribed one, it will do you a lot of good, and it will do the job that you want it to do. Okay? Now, my other recommendation on how to use Tretinoin is, if you're just starting to use it, make sure you use it like 2-3 times a week. Don't use it every single day, and make sure you use it only at night. And after you apply Tretinoin on your skin, follow it up with a lot of moisturizer. Keep your skin hydrated, because if you don't do that, it's going to dry your skin out. It's a very strong medicine. It's going to dry your skin out. So moisturizer. You apply it at night before you go to bed, and during the daytime, because you're using Tretinoin, you try and wear your sunscreen with your moisturizer. Now, another thing is, before you apply your Tretinoin, make sure you apply it on a cleansed face. Don't apply your Tretinoin on a dirty face. Make sure you've double cleansed your skin without soap, with a mild cleanser, not soap. Avoid using harsh soaps when you're using Tretinoin. Avoid using harsh soap, because harsh soap already has very strong ingredients, alcohol, fragrance, and it's just like a little bit too much, on your skin to use harsh soap. So use a mild cleanser, cleanse your skin, apply your Tretinoin. After that, then you follow it up with moisturizer, and it will work. It will help solve the skincare problem that you're using it for. Okay, sometimes when you're starting Tretinoin initially, you may experience peeling of skin. Your skin may start peeling. Okay, do not panic. As long as you're not abusing it, do not panic. It's kind of doing its job. After a while, it will stop. So that is why my recommendation is you use it 2 to 3 times a week, to allow your skin to get used to it first, before you can now progress, depending on what your specialist recommended for you. Okay, and then you can follow it up like that. All right, do not use Tretinoin if you're pregnant, and do not use Tretinoin if you're nursing a baby, and do not use Tretinoin if you're expecting a baby. Okay, if you're planning to get pregnant, because it's retinoid. You know, whatever you put on your skin, about 30-40% of that is absorbed through your bloodstream. So you don't want, sometimes retinoid is part of retinoid, it's part of vitamin A retinoid. It can interfere with your DNA. Okay, I hope you find this video very helpful. If you have any question, leave your comment below. If you want me to review any other product for you, leave your comment below and I will try my best to do that. Thank you so much, my favorite people. Remember, treat your skin right and your skin will treat you right. I look forward to seeing you in my next video. Mwah.